I'm Dr. Fache. We convened this meeting as a way to be able to reach out to people who are having some difficulty trying to conceive, and as a way of support to give information, because we realize that the major problem with people is getting the right information and being able to make the right decision, and making that decision on time, because time is of essence when it comes to making decisions in your fertility journey. So we decided to do this boot camp, have people who are in this journey to be part of their journey. So, so the topic is your fertility journey, understanding what works for you. We've done some kind of introduction, but then in the course of the conversation, we would like to hear stories, because like she said, it's a family. So we're all here, we all seem to have the same endpoint, and that endpoint eventually is to be able to have a baby or have babies. I suppose I'm right? Yes. So understanding works for you would come in the course of the conversation. This is me, a brief summary of what is applicable to this presentation. I'm a senior consultant gynecologist, a fertility specialist, and minimal access gynae surgeon. I'm the medical director of Procare Hospital. I'm a member of the Nigerian Association of Fertility and Reproductive Health, the European Society of Human Reproduction and Embryology, the American Society of Reproductive Medicine, European Fertility Society, and the International Society of Stem Cells Application. This is just what is relevant to this presentation. I'm a member of so many other associations across the world, but it's not an avenue to list all of them. So we go quickly into the main theme of the topic. So I'm going to create a background that basically there are 5 things that need to happen to make a pregnancy possible. This is basic biology. The first among them is the fact that a woman's ovaries need to produce high quality eggs. High quality is important. Good quality. Young people have mostly good quality. Older people have poor quality eggs. We'll get into that detail. The egg needs to be able to mature and be released into the woman's fallopian tube. And then the fallopian tube is the tube that connects as a conduit pipe between the ovary and the tube and the womb. So the fallopian tube, it needs to be open at both ends. So then the high quality sperm needs to reach the fallopian tube to fertilize the egg. The resulting embryo needs to be able to travel back to the uterus and then implant in the wall of the uterus. These are 5 steps that are important for pregnancy to happen, and it all starts with the egg. It all starts with the egg, very important. And you see that the man comes in, 4th stage, high quality sperm to fertilize the egg and reach the egg to fertilize it. So this is a diagrammatic representation of all that I have said. This is A, ovaries produce a quality egg, this is ovary. So this is a diagrammatic representation of the female reproductive tract, where you have the ovary here, you have the tube, and then you see the tube there, then this is the uterus, and so this is the vagina here. So this B, the egg would mature and is released into the fallopian tube. Then the fallopian tubes are open on both ends so that the egg that is released from here can travel down and then meet with the sperm that was deposited here during intercourse, for instance, and then the sperm travels and they meet in the tube and then fertilize. High quality sperm reaches the fallopian tube and fertilizes the egg. That's the 4th one. And then the fertilized egg, which is now the embryo, travels from the tube to the uterus and implants in the uterine wall. So that's, are we together?
Yes.
Okay, so this is the basis of reproduction, and that is the requirement for any woman to be able to conceive naturally. So we go on to the next slide that says that if one of these steps doesn't unfold, and a woman or a couple has trouble conceiving naturally, there are a lot of options available, but here we will just mention the 3 common treatments that you've seen, many of you may have been familiar with. First one is using oral medication, mostly for ovulation induction. So most times, there are majority of women or couples who are unable to conceive have issues with ovulation. You see, the first step was not able to release high quality egg. Sometimes these eggs are not released as they are supposed to. And so the starting point usually, many women will be given oral medication like Clomid or Letrozole, and then to have sex around their fertile window, and then so that they can also have that high quality sperm. If that doesn't work, so we call that ovulation induction generally. Then we go on to the next one, which we call intrauterine insemination or IUI. It is a bit more intensive than ovulation induction. And then, of course, it's also called artificial insemination, which is basically injecting sperm directly into the uterus. So in this situation, you have bypassed the cervix. So when men have mild low sperm count, or maybe you feel that there is obstruction at the entrance to the womb, you can get the sperm and deposit it inside the uterus. It shortens the distance that the sperm would have to travel to meet the egg. And then it also helps to select the highest quality sperm cells from the semen. That is IUI, or intrauterine insemination, artificial insemination. And then, of course, if that doesn't work, you can go on to have IVF, which is in vitro fertilization. It's the most intensive among the treatments. And in this situation, the eggs are surgically removed, fertilized in the lab by bringing the eggs and the sperm together, and then the resulting embryos. Now, once an egg is fertilized, it begins to be called embryos. They are transferred back into the uterus. So these are the 3 main fertility treatments that many of us may have had one or so option. How you determine which one is applicable to you will depend on what is found to be the reason for your delay after proper evaluation. So the timing of treatment, so that unfortunately this treatment doesn't work as well for all patients. But what is key is that patients who begin treatment at younger ages have a baby more quickly. Does that make sense? Women who begin treatment at younger ages have a baby more quickly. And so as we go along, you would see the breakdown of birth rates per cycle for both IUI and IVF broken down by age. You would see that most of my discussion would revolve around decision and making this decision quickly, because a lot of times we've seen patients procrastinate a lot, drag feet about what to do. There are so many complexities, reasons why people do not seek help at the right time. So we see that as women age, the volume and quality of their eggs begin to diminish. And unfortunately, this lowers the odds that a woman will produce a high quality egg, which is a requirement for a woman to conceive naturally. This fact that success rate goes down with age is crucial. Put African American women, because some of these studies were done in the US. And so we see that, of course, I was talking about delay. I will expatiate on that as we go on, where they have seen that even in America, the Black women are behind in taking decisions quickly, to seek medical help. One of the reasons is the fact that Some of them believe in their faith more than the medical system. And so maybe when they begin realize that they need to seek help, they begin to go to churches first rather than seeing the medical. And so as you see that 1 or 2 year delay in fertility treatment can be detrimental, especially in IVF. You see that every delay, both for natural conception and any form of fertility treatment, delay is dangerous. And so you see that in the course of that you will see where an 11-point gap makes a whole lot of difference in the success rate per cycle. So this is a graph of IVF success rate. For instance, you see that for women, don't worry if you don't understand how to read the graph, I will take you through. For women who are less than 35 years, this is their success rate. So when they do IVF, their success rate is about 47%. Can you see that? Now, once you are 35 to 37, that success rate drops to about 32%, about 15 points drop, which is a 29% drop in success rate. So what this means, for instance, is if you are 33, 34, and then you're dragging feet before you decide to take up IVF, then you have succeeded, assuming that there are no other factors. Maybe it's just age related, we don't know why we're not getting pregnant, and then you can see how that delay can cause a significant reduction in the success rate of IVF per cycle. And then you come to see that between 38 and 40, the success rate is about 20% here, and then just 42, it drops down to about 5%. So if you look at this graph, you can see what is key, what is very prominent is the fact that the success rate goes down as the woman gets older. So between 35 years and 42, it has dropped from 47% to about 5%. And so when a woman comes to you and then you're looking at her age and making decision, then they're asking you, doctor, is it not too quick? It is not too quick, because if I am seeing a lady that is 33 years, I'm not going to be counseling somebody that is 40 years in the same manner. Are we together? Yeah, so you can see two women, same problem, but the way you're counseling the one that is 40 years is different from the one that is 33 or 32, because look at their success rate, 47%. And then I'm seeing somebody whose success rate is around 10%, and then they expect you to say, go and try for 6 months, go and try for 1 year. By the time you are coming back, your success rate for IVF have dropped to less than 10%, and then we'll start singing the song of third-party reproduction, donor egg, so that you can increase the success rate. And then people again say, doctor, is there nothing I can do? So this is the challenge we face as doctors, fertility doctors especially. People do not understand how their age affects their success rate, even naturally. So you see that, as you can see, under the age of 30, if a woman can't conceive naturally after 6 to 12 months of trying, then the odds that she'll be able to succeed in any successive month is incredibly low. So it means that the first few months, even this is natural conception now. For that reason, most doctors will recommend seeing a fertility specialist after 12 months if a woman is age 34 or younger, and after 6 months if she is 35 or older. Now, when women get to 40, and we counsel them, if you're just getting married, as soon as you finish that marriage, you need to go and see a fertility specialist for evaluation, just so that we're certain. So again, talking about how IVF overcomes fertility issues, Where somebody has poor quality egg, there are drugs to make the eggs, many eggs, and raise the odds of producing good one. So if your eggs are not very okay, so when you produce many, then the chances that some of them will be okay is higher. Then when there is no ovulation, of course, IVF drugs will make you ovulate. When the tubes are blocked, we do not need the tubes for IVF. So that is the main reason, first and foremost, that IVF came to be, that we do not need the tubes for IVF. But there are, there are instances where these tubes, not only are they blocked, but they are damaged. And sometimes we are having to perform surgery to even take off the damaged tube. This is again where some women are concerned. Like, you have tube, not only are they preventing you from getting pregnant naturally, they are going to be detrimental to your IVF treatment. And so you'll be advised by your doctors to say, okay, we need to disconnect this tube from the body of the womb so that whatever bad fluid that is coming from it do not even wash off or kill our embryos that will be depositing here. So one of the conditions we call hydrosalpinx, for instance, when a woman has blocked tubes and then there's fluid is swollen and then it accumulates fluid. So these are some of it. Then, of course, low quality sperm. IVF improves the odds of fertilization through laboratory techniques. If somebody has low sperm count, low morphology, low motility, we can use methods like ICSI, where we call intracytoplasmic sperm injection. That's ICSI, to be able to select the best of the sperm and inject them directly into each intracytoplasmic sperm injection. And then, of course, we go into the last one, problem with the womb. The emphasis of this is understanding, because a lot of times people take so much time. It seems like, okay, we all know that there is IVF, but we don't even know the limitation of IVF. We do not know the limitation of IVF. And so we wait until it is too late. Like I've mentioned earlier, if you are older, then you may not be able to give us good number of eggs or good quality of eggs. Okay? So as you also get older, some of the things that affect women tend to be more. Like you have uterine fibroid. As you get older, they begin to become more common. You have polyp. So these are some of the things. So it's like the older you get, your natural tendency to conceive is reducing. Even the treatment that is post fertility treatment are also less successful at an older age. And again, this emphasizes and underscores the need for making your decision early and not wait as if IVF is that treatment that answers it all. It is not. There are certain challenges that IVF cannot bypass. One of them is you don't have eggs, we can't help you. The only way we can help you is maybe donor eggs. Until recently, where we're also talking about ovarian rejuvenation, which of course is something new, and we know that it's useful and helpful to some people, but at this point in time, we're not able to determine who it would help until you have it try, and then you see whether it's useful. So we have written here that IVF is the most successful fertility treatment, but it doesn't always, it doesn't work all the time. And in fact, the majority of IVF cycles don't work. So as a result, women who elect to do IVF often undergo multiple cycles. Again, this is a fact that we need to understand. IVF is expensive, but IVF is just like one menstrual cycle. in the real sense of it, it's just like one menstrual cycle. So when you're going to do IVF, because of the financial implication, most times people think this is like the last bus stop. I've tried every other thing, has failed. Let me just go and do IVF. And so they come hoping that the first cycle should be the last. That is also our hope as providers. But the truth is, we know that even, I'll give a clear example. People who do IVF, like they don't have issues with fertility. Maybe they are doing it because they want to balance their family, gender balancing, or they are doing because both of them are AS for instance, and they don't want to have an SS baby. These people do not have fertility treatment, but sometimes they still do IVF and it fails. It's also that we know that there is no system, no treatment that is 100% efficient. So, and we've written here that IVF success rate correlates closely with age. And yet, even among the most promising candidates who are women under the age of 35, an IVF cycle results in a live birth less than half the time. In women who are over age 42, less than 5% of IVF cycles culminate in a live birth. Now, these are data coming from abroad. And it's important for us to understand this success rate because many a times women have been deceived. These are data coming from very international centers in the US and UK, and this is the success rate they are quoting. So if you walk into one bedroom hospital in Nigeria, and I say, what is your success rate? Because people ask this question a lot, and I look at them, are you asking the right question? Because how do you confirm? You are asking somebody, I want to sell something, so is this laptop good? I will tell you it's the best laptop you can ever get, unless you have good conscience. And this is where a lot of women have misled themselves because they are eager to ask the doctor, what is your success rate? And then people come here and say, oh, they told me they have 90% success rate until I have done 3, 4, 5 cycles. Then I realized that. So when you ask people and you get that kind of answer, please reevaluate the clinic. Because even the best of standard centers, best of countries do not record that kind of high success rate. It is also important that you evaluate your doctor. If a doctor closes eyes and tell you, I have one success rate that fits all, I'm sure you would understand based on what we have discussed that if I am 25 and 52, I'll be 52. So if she's 25 and then she is 30, somebody else is 40, their success rate cannot be the same. So you can't have one success rate that fits all. Yes. And so the best way to do this is stratify success rate and say, okay, if we are doing success rate based on age alone, what it will be? What is even the impact of our age first and foremost, before we now even consider the reason that is even responsible for the IVF treatment. So this slide, I mean, like I said, this was like it's an informal conversation. I just want to give a background so that we are able to catch something. So this is a slide that is comparing IVF and IUI success rates by age. So you see here that for people that are less than 35, again, you see the IVF success rate about 40 something, 47, and you see IUI is 10%. Can you see that? Yes, and you see, so green is IVF. This is, here is 5 times higher, 4 times higher, 3 times higher. For every age, IVF success rate is higher. Even here is 3 times higher. Why it is important for us to also get this information, a lot of time people come and say, okay, they have done several ovulation induction, go and take Clomid, I'm not getting pregnant. And then you tell them, since you have done this, looking at your age, you think you should have an IVF, and the next time they are coming is, okay, we have decided to do IUI. And then sometimes we're shocked, like, okay, where did this information come from? By the time you are doing 3 IUI, the money you have spent on the IUI is enough to do an IVF. And if you see that here is 5 times higher, it means that for you to match up, you probably need to do 5 IUI to be able to meet up with the success rate of 1 cycle of IVF. And so sometimes we feel that maybe because this is IVF, 3-letter word, IUI, 3-letter word. Yes, because the only difference is VF and UI. Okay, so when you look at this, maybe that is why women think that, if I instead of doing IVF for 1 million, why don't I do IUI for 350? But look at the success rates. It's very low compared to IVF for every age. Okay, so when you see your doctor and then there's advice to do IVF, what I will encourage everybody here is, please, he who pays the piper dictates the tune. If I walk into a supermarket, I want to buy something and I think I'm not comfortable, I would ask the person. So I see that a lot of patients don't ask their doctors questions. If you ask your doctor question and is not willing to answer, please leave that hospital, because you're paying and you need to know, especially when it's something that concerns your treatment. Some of these questions are coming because some patients have gone to another hospital, they have been told by their doctor something. So if you're telling them something, they need to clarify. And so if somebody is not willing to answer your question, then you should be suspicious. But you ask this, why are you asking me to do IVF? Why can't I do IUI? Then we can tell you that, okay, your tubes are blocked, so IUI will not even work. Because you need at least 1 good tube to be able to do ovulation, induction, and timed intercourse, or IUI. IVF is the only fertility treatment option that bypasses the tube. Your husband has very low sperm counts, IUI will not work, because no matter how much of concentration you give that sperm, it's not going to be able to give you enough sperm to fertilize. So that's it. So of course we talked about impact of female age on the IVF success rate. So this is how it looks: IVF age and IVF success rates. You see again how it's dropping. 15% drop between 35 and 37, 13% drop between 38. So starting from here, less than 35, getting to about less than 5% when your age goes above 42. This is just like 7-year gap, right? Yeah, so if you got married at 35 and then you're having to delay to conceive, by the time you get to 42, then your success rate, if you had done IVF at 35 at that time, when you realize that there's a problem, then would be here instead of here. So we also looked at cumulative live birth rate by cycle number. So you see that when you are younger, under 40 years, you see how the success rate, first cycle, second cycle, third cycle is going, fourth cycle. These are productive, you can see second, third. By the time you do the fourth one, then the increment is beginning to decline. Look at people who are 40 to 42, second, third, fourth cycle, less productive. And even people who are 43 and above, second, third cycle is not productive because the success rate is not going up. You can see it there. Are we together? Yes. So, and so this just helps us, like, instead, when you are there at this level, instead of doing repeated cycles, except of course we know that there are people who may not, donor egg is not something that's first choice for anybody. And so sometimes people want to do all they can. They want to do egg banking to be able to, if you have the money, yes, you can be doing multiple cycles, do one cycle, get one egg, you keep it. And here, so one egg will keep it, 1.4 million. Another one will keep it like that. Some people have the money, like, they want to try, because you're not just looking at quantity now, you're also looking at quality. Yeah, so these are the challenges. So if you don't have that energy, you go on to here, and here we're comparing how using donor eggs impact IVF success rates. So you see that here, this woman is age 42 using own egg. Look at the success rate, it's just barely above 0. After 9 cycles, at 7 cycles, so success just moved to about maybe 10%. But then, if you use donor egg, the first time you have about 5% higher chance of success. And by the time you are doing like 4 cycles using donor egg, it has increased, the difference has increased up to 8 times. Okay? So, thank you. We try to extract salient points, something that will probably help our decision making, because what I wanted you people to understand is if you need to make your decision early, make the right decision. The fertility journey we're talking about is not a journey that anybody plans for. Majority of us are Christians, some are Muslims, and then you know that passage in the Bible that says, "Go ye, multiply." So everybody gets married and looking forward, first month, second month, third month, and she'll be carrying my baby. So it's not a journey that anybody prepares for, to say, okay, when I get married, then I'll be embarking on this journey. So you cannot go and apply for visa, you cannot plan where your next move is, because your destination is different from the reality at the end of it. So it comes to everybody as a surprise. And so when people start noticing that it seems there is a delay, most of the time people do not go to the hospital. Many a times I'm seeing women, they are already taking one supplement or the other. But as you can see there are 5 things that needed to be working well. So if you are taking supplements on behalf of your husband who have low sperm count, it's a waste of time. If you are taking banana and milk when there is blocked tubes, it's a waste of time. So I think the first thing is when we understand the definition. I am less than 35. I have tried this 1 year. It's not like husband is an American, wife is in Nigeria. They come in December and then they have intercourse. The date of booking does not take into consideration whether the woman is going to be in her fertile window or not. I'm just going to spend 2 weeks, and that 2 weeks is your fertilization your ovulation has just ended. That's when I landed. And 2 weeks in a year is not enough. So even that kind of marriage, they need to be thinking of fertility treatment so that things can be planned. When you're going to come, thankfully, the systems we have today, we can play around with women's cycle. So, okay, this ovulation, the time my guy is going to come is not going to be when I'm ovulating. You say, don't worry. We will manipulate the system so that it will be around when he's coming. So this is not even IVF. Ovulation induction, but when you're talking with your doctor, they are able to plan this ahead. My ovulation happens early in the month. My husband will be coming middle of the month. And so we are able to say, okay, you know what? We can manipulate your cycle. So you can take decision. We have also seen how, so first is finding a good and a reputable fertility specialist when this journey needs to start. People need to talk to themselves. Husband and wife need to discuss. We have done this for 1 year. Our neighbor didn't do it for 3 months before something entered. So based on the knowledge available, say if you have done this for 1 year and nothing is happening, you need to go and see the doctor. Don't begin to formulate causes in your mind. I look around, people are wearing beautiful clothes, then enter the shop, it's okay, this is Zara. Say, are you sure it's the original one? Because this one you say is 5,000. I know original Zara is 20,000. Give me the one that is 20,000. Madam, am I lying? When they come to fertility, say, no, this one is charging 50,000. No. Show me the one that is charging 5,000. And then you go there, then you waste your time. So we see women, they are coming, they have gone to roadside ultrasound houses to scan. These people are not gynecologists. They are not even, talk less of being a fertility specialist. Okay? So the things they are going to tell you may not be the right thing. Yes, I mean, they don't have the training. So they tell you, maybe they are taught to scan, they don't even know that your tube needs to be open. So they see your ovary and say, pelvic structures appear normal. You are looking for baby, you are not looking for normal results. Be truthful to yourself to say, okay, tell me what is happening to me so that we can find solution. Don't tell me everything. Because I ask women, you've been told long ago that everything is normal. But you're not getting pregnant. You're not asking the doctor, why am I not getting pregnant if everything is normal? But it seems as if it's a kind of answer that most people, they want to be told that everything is normal. So if your doctor is telling you everything is normal, 6 months, nothing is happening, go there, madam, go and keep trying, everything is normal. Please look for another doctor, because it is possible that within his limit of practice, he doesn't have what it takes to find out what is wrong with you. We see women all the time say we have done all the tests. And I tell them, you probably haven't even done half of the tests. You've done the test that is available where you have been. And so then you need to do further tests in other places so that we can find that, yes, there are a few percentage of people where we are not able to find anything wrong with the woman or the man, and those are classified as unexplained infertility. And even at that, because of the impact of age, we still advise them to do fertility treatment, any of the fertility treatment that is applicable. So let it not be a monologue, because I'm wondering like if I'm singing since I'm the only one. So I would stop here so that we can hear stories. We want people to tell their story. Your story may encourage some, but that's what we're looking at. A forum, family. Your story of your journey so far may encourage somebody. You may also give us a sense of direction to help other people. We are at different stages of our journey. Yeah, so let us share our story, ask questions, and then we'll be able to guide you through this journey. Thank you.